Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the spleen. What is spleen? Spleen is an ovoid, purplish, highly vascular, pulpy lymphoid mass located in the left hypochondriac region of the abdomen. So it is under cover of the ribs, but it is the content of the abdomen. It is highly vascular, it is pulpy, it is ovoid-like ways between the stomach and the diaphragm and the kidney. The spleen is about 5 inches long, 3 inches broad, and 1 inch thick. And its size and shape is variable from person to person, and certainly it may be many times bigger, maybe 3-4 times bigger in certain diseases. It is related to the 9th to 11th ribs. Here we have the 9th rib, 10th rib, 11th rib, and the axis of the spleen is obliquely located along the long axis of the 10th rib. This is the 10th rib here. It has two ends and 2 surfaces and 3 borders. Okay, here is the inferior pole, superior pole. 2 surfaces. This is the visceral surface. The other side is the diaphragmatic surface. 2 end means 2 poles, inferior pole, superior pole. The diaphragmatic surface is smooth, and this surface is related to the left dome of the diaphragm. The visceral surface is concave with multiple concavity because it is in contact with multiple viscous, so that here this is the gastric impression. It is related to the fundus of the stomach. Here is the colic impression. It is related to the left colic flexure, and this is the renal impression. This is related to the left kidney, and this part is related to the pancreas, the tail of the pancreas. So what is hilum? Hilum lies in the inframedial part of the gastric impression. Hilum is the space through which the blood vessel get in, blood vessel get out, along with the sympathetic nerve fibers. So this is the impression formed by the tail of the pancreas. The spleen is covered by peritoneum except at the site of the hilum area. Otherwise it is invested, covered, surrounded by the peritoneum, and it is suspended by the gastrosplenic ligament and linorenal ligament. This also has relationship to that of the phrenico-colic ligament that is not attached, but it supports the anterior part of the spleen, that is the phrenico-colic ligament. The relations of the spleen: anteriorly, stomach is here. Posteriorly, the left dome of the diaphragm. Here is left dome of the diaphragm. Inferiorly, left colic flexure. Here is the left colic flexure. Medially, the left kidney, upper part. Here, there should be left kidney. Pulp of the spleen. If we cut a part of the spleen, we'll get the pulp inside it. We have the white pulp, we have the red pulp. White pulp are around the central artery, okay, and the site of immune and phagocytic function. Red pulp of the spleen consists of venous sinusoids. We have a lot of, these are all venous sinusoids and splenic cords there, and the primary site of filtration. So this is red pulp, this is white pulp. This is the capsule of the spleen. This is the extension from the capsule, we call it trabeculae. Blood supply, splenic artery. Splenic artery is a branch of the celiac trunk. Splenic vein is formed inside the spleen, where multiple small venules will contribute to the formation of the splenic vein at the hilum of the spleen, and the splenic vein will unite with the superior mesenteric vein behind the neck of the pancreas to make the portal vein. Lymphatic drainage, there is no lymphatic from the splenic tissue proper, but there is some lymphatic from the connective tissue and the capsular part of the spleen to the pancreatico-splenic lymph nodes. Nerve supply, sympathetic from celiac plexus. This is vasomotor, that is, it is vasoconstrictor. Functions of the spleen, phagocytosis, because it is a part of the reticuloendothelial system. It is a lot of macrophages and other phagocytic cells. Hematopoiesis, spleen is a site of red blood cell formation during the embryonic life. Even in the adult life, it continues to form the lymphocytes. The spleen is associated with immune response, and spleen is a site of storage of RBC, especially in some other animals. Clinical correlation will go there. We may have accessory splenic tissue because spleen develops from the dorsal mesogastrium, from the mesoderm, and we may have accessory splenic tissue at the hilum area of the spleen, main spleen, maybe in the mesentery, maybe near the testis or the ovary. Usually it is close to the hilum of the spleen near the gastrosplenic ligament. Splenomegaly, yes, any type of infection like that of malaria, chalasar, even typhoid fever, spleen is enlarged. Spleen may be enlarged due to portal hypertension. We call it splenomegaly. We can palpate the spleen. The superior border is lobulated because embryologically it is lobulated structure, so superior border has notch. Rupture of the spleen may be ruptured, is vulnerable to injury, especially the blunt injury or fracture of the rib, and it may cause profuse hemorrhage. So surgeon in most cases do the splenectomy, take out the spleen. Other part of the reticuloendothelial system will take part the functions of the spleen. Lymphoma, that means the malignant tumor of the lymphatic tissue, including the spleen. We have Hodgkin's lymphoma, non-Hodgkin's lymphoma, and spleen may be involved in lymphoma. And that's all about the anatomy of the spleen. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.